Uganda's young population, one of the fastest growing in Africa, faces complex health challenges that go beyond the hospital walls. From teenage pregnancies and HIV infections to mental health and violence, the well-being of adolescents is now testing the country's commitment to inclusive health and social protection.
We are still grappling with the high teenage pregnancy of 24%. And also amongst them, between the ages of 15 to 24, we still have a very high, we still have sepsis as one of the major causes of death of that age group, because most of them are related to aspect of unsafe abortion. So as a ministry, we definitely have scaled adolescent-friendly services in our health facilities.
Government data shows that 1 in 4 teenage girls has started childbearing, and new HIV infections remain highest among adolescent girls and young women. At the same time, mental health needs are rising, yet few facilities offer youth-focused counseling or support.
How do you reach them? We need to be able to see how we can reach them either in the play areas, particularly those who are playing football, so that as they are coming to play football, they are also accessing sexual and reproductive health services. So it really means that we need to do something different. If we wait for them in the health facilities, it will be too late.
At the Ministry of Gender, Labour and Social Development, questions persist over how far programs have gone to protect girls from sexual violence, early marriage, and to help young mothers return to school.
You've heard about the UPE program, the USE program. The idea being that the longer the young people stay in school, apart from getting skills and competencies and knowledge that they will need later in life, it also helps them to stay away from a number of distractions, particularly the girl child.
The local council chairpersons, some of them negotiate some of these defilement cases. But when you're negotiating those cases, and even the parents when they are involved and you're given money or compensation, it means that you're not protecting the rights of this young person. What we have to do is to report such cases to the police or to the Welfare and Child Protection Office at the district through the probation officers. And when we report such cases, these cases can be committed to court, and we ensure that these young girls access the justice.
Us at police, we're supposed to be friendly, approachable, but also avail ourselves to comfort them. One, so that they can be able to tell us what exactly happened, how did they get assaulted, maybe who could have connived to have them sexually abused, so that we get a very good statement which can bring the perpetrator at book, because the victim's statement is very instrumental. Once we have that statement, then we are good to go. And we also have to assess their other needs. Besides the legal needs, they have the education needs, they have the medical needs, education needs.
Non-government organizations working with young people say more must be done to reach those in hard-to-reach areas, from island communities to urban slums, and to sustain programs once donor funding ends.
Through, for instance, the project of delivering innovation in self-care, that this project has mainly been known in the districts as one of those projects that are supporting the district, one, to create awareness, but also demand for the self-inject contraceptive. The contraceptive that enables young people or users to protect themselves from pregnancies for a period of 3 months. But also through this, we conduct primary health care activities and outreaches that aim to increase access of these services, FP services.
Uganda's adolescents stand at the heart of the nation's future. But as long as access to health, protection, and social services remain uneven, the promise of a healthy, productive youth population will remain just a promise. Walter Mwesije, NTV.